Hello everyone. Today we will be learning about the barriers in effective counseling from chapter number 5, Patient Counseling, from the subject Community Pharmacy and Management, presented by KG Saraf, lecturer, KK College of Pharmacy, Nasik. Barriers for effective counseling. Barriers means what are the obstacles or what are the difficulties for effective patient counseling. So, the barriers are divided into three types. First is pharmacist related barriers, second is patient related barriers, and last is system related barriers. So, we will see one by one. First is pharmacist related. So, pharmacist is the actual professional pharmacist who is present to counsel. So, what problems or what barriers are there for effective counseling in from pharmacist side? So, first is lack of knowledge about patient, lack of knowledge about patient's disease condition, lack of confidence or skill. So, these are some barriers which the pharmacist may have. He may not know the patient, he may not know the patient's condition, or he doesn't have that much confidence or that skill to counsel. Then attitude and beliefs of pharmacist, business motive of pharmacist. That means that pharmacist may be a business professional. He doesn't look at the profession as a healthcare provider. He is just looking at it as a business motive. So that would be some of the outlook of some of the pharmacists. Judgmental attitude, age difference, then religious differences, inappropriate non-verbal communication, filtering of information, messages that are received but ignored, lack of proper training and time. Okay, sometimes the pharmacist doesn't have the adequate training or knowledge regarding counseling, regarding it does not have the updated knowledge about the latest drugs, about the latest treatments, or some kind of new diseases. So, due to this, that will arise a difficulty or barrier in counseling. Then, language difference, he may be not very proficient in some other regional languages. Lack of listening. Listening is very, very important. Unless and until you listen to the patient's problem, you understand the patient's problem, you cannot counsel him. So, sometimes the pharmacist doesn't have that much listening skill, or he doesn't listen to the patient's problems. Then lack of planning and lack of cooperation from patient, that may also be related to the pharmacist related barriers. Now, second is patient related barriers, lack of trust. Some patients do not look at the pharmacist as an information giver. They do not look pharmacist as he is a appropriate one to give you the information. So that is a lack of trust among some of the kind of patients. Lack of knowledge of non-verbal communication, lack of motivation. So sometimes the patients are not themselves motivated to get counseled or to know about the disease. Some cultural or religion beliefs, poor listening, lack of time. Time would be a major factor, that patient is not having a sufficient time to listen to the counseling. Then distance and lack of transportation facilities. Sometimes they live at a remote area, or they don't have a proper transportation facility to get the counseling done, or to come to take the medicines by themselves. Information overload. So this is in case when the people already have a lot of information or about the disease, or if they are using some technology to upgrade their knowledge, and that would be lead to information overload. Physical or mental status or emotions. So physically is not fit to listen or to hear, or emotionally or mentally is disturbed and not able to listen to the counseling. So that would be some barriers. Wrong or unclarified assumptions, filtering of negative information, gender difference may be one of the factor. Some male patients are comfortable with the male pharmacist, or vice versa, female patients are comfortable to clear their doubts with the female pharmacist. So that may be some barrier related to gender. Language differences may arise if the pharmacist and the patient does not understand each other's language. lack of honesty, misunderstanding, literacy also affects counseling, financial barriers, lack of social support, failure to disclose the information. Some patients are reluctant to tell what problems they are facing. Some patients are reluctant to disclose their information in front of the pharmacist. Depression, alcoholic and drug use, poor communication, hearing or vision problems. So these may be some of the patient related problems. Next is the system related barriers. So lack of privacy in community pharmacy means there is no proper adequate space provided for counseling. There is a lot of rush in the pharmacy shop. There is no privacy there so that the patient can talk to the pharmacist and clear his doubts. Okay, so lack of time. Sometimes there is a pharmacist and the patient both are having lack of time. Pharmacist may be busy in his daily work or attending lot of patients at a time, so that may cause barrier. Then pharmacist not having access to patient's full medication history. Sometimes patient's history is not known to the pharmacist. Poor communication between the pharmacist and the physician. Sometimes physician and pharmacist communication is so poor that they are not aware about the patient's treatment going on. So, and lack of pharmacist in a pharmacy shop. Sometimes only one pharmacist is present to attend everything, so he will not be able to attend the patients for counseling. So if there are proper organized system or proper number of pharmacists in the pharmacy shop, then the counseling can be done effectively. So these are all the barriers related to patient counseling. Thank you.